Brian, thank you very much to Henry Ford for just making this possible today. Thank you too to Elaine and the Zero Suicide Alliance team for making all of this seem seamless, which I hope it does seem seamless. I don't know what chemicals you spread in the air last night, but well done to get that sunset. For those of you who are fresh in the room today, we're going to have a very special message from someone in a minute. For those of you who stayed overnight, I hope the headache isn't too bad, but Liverpool does that to people. In just a few words of introduction to today, I was struck by Brian's comments and by Dave Covington's comments yesterday about how provocative in the context of suicide the word zero is. It's hugely enabling. I mean, my own experience leading an organization through this for over 10 years now has been incredibly enabling, but it's probably been also simultaneously the most difficult thing I've ever done, because it provokes effort, energy, enthusiasm, imagination, and on the other side it provokes lots of cynicism and difficulty and so on. And it reminded me just of a little bit of work we did many moons ago at the start of the Zero Suicide Alliance when we were developing our training. We had some before and after questions, and one of the questions was, is suicide inevitable? And what really struck me when we conducted this with 3,000 members of our staff, about 90% of people, and that was clinical and non-clinical, about 90% of staff said, no, suicide's inevitable. It's not something you can turn back. Really interestingly, after they did the training, that number dropped to about 10%, which is a great validation of being able to train. But actually it left me with this issue in my head, which I think I've always called the inevitability paradox. You know, how, if people think something is inevitable, if we project that out into the general public, how, if that's true, can we actually get effective prevention? Because the two things are not actually synergistic, they're antagonistic in that respect. So I think I'm saying this because I think it would be interesting as we certainly move into the first session where we have sort of zero suicide in the context of national policies. I think it's a really important opportunity that national policymakers are in the space of trying to understand that particular paradox. I think the contributions we'll hear from people with lived experience today, I think, may also give us a completely different perspective on that. And later we'll talk about maybe some of the opportunities to think about how we understand context differently through the basis of data, which again gives us new routes into asking new questions about this. And then I guess lastly, when we think about the return on investment, it's really, really difficult that we're able to address that paradox. We're able to be really clear in terms of the business case we put forward, because just about everybody in the room will have had struggled really hard to get funding because I think of that paradox, that thing that sits in the back of everybody's head. So I think it lines up to be an absolutely fantastic day today. So I'm going to, Brian, do I just click this to go on the video thing? Yeah. So we've got a message from His Royal Highness, the Prince of Wales.
Thank you for inviting me to join you today. I'm so sorry I can't be there in person, but I hope you'll allow me to say a few words, albeit virtually. Suicide prevention is an issue which I hold very close to my heart, and I'm delighted that today's summit is being held here in the UK for the first time. Sadly, I have seen and felt the impact of suicide firsthand. My first call out as a pilot for the East Anglia Air Ambulance was to a suicide. My memory of that call out is as clear as if it was yesterday. Devastatingly, 700,000 people die by suicide across the world every year, and 6,000 of those are in the UK. The evidence suggests that mental ill health is a more pressing problem than ever before. 1 in 5 of us will experience suicidal thoughts over our lifetime. That is why this year's summit is so important. And by coming together today, I hope that you are able to share best practice and discuss how support and attention can be mobilized across the globe. Initiatives such as the Zero Suicide Alliance, help highlight how we can all support suicide awareness and prevention. Nearly 2.7 million people have accessed its suicide prevention training. Here in Liverpool, Merseycare NHS Foundation Trust is actively working to seek out new ways to prevent mental health crises. I have visited many suicide prevention and support services over the years, including the innovative Life Rooms in Liverpool back in 2017, and more recently, James's Place Sanctuaries, which also began life here and are now being rolled out across the country. I'm immensely proud of the UK's role in helping advance suicide prevention techniques, which are shared around the world. We're all extremely grateful for your commitment to such an important cause, and I hope this summit, with all the ideas and expertise within it, can make real strides towards eliminating suicide. Thank you.
So what a brilliant message, eh? So a great way to start the day again, and back over to you, Claudia. Thank you.